Hi there, my name is Taylor Selke, and today we'll be talking about antiphospholipid syndrome. Antiphospholipid syndrome is often abbreviated as APS. During this lecture, we will refer to it as such. Antiphospholipid syndrome is also known as Hughes syndrome and antiphospholipid antibody syndrome. APS is a disorder that occurs when there's an elevation of antibodies that are associated with clot formation. This elevation ultimately puts the patient at risk for conditions associated with arterial and venous thrombosis, as well as recurrent miscarriages. It is considered to be autoimmune. Antiphospholipid syndrome has a greater prevalence among women over men. There are two diagnoses when looking at antiphospholipid syndrome. The first is considered primary antiphospholipid syndrome, in which the person has no underlying autoimmune issues. In secondary APS, the patient usually does have another autoimmune disease. It's important to point out that there's actually little clinical differentiation between the two designations between primary and secondary. While it's noted that APS is very common in families, there are actually no genetic markers that can help us predict if it will be inherited. And little studies have been done on the race and ethnicity in regards to prevalence of this disease. For those who've had strokes under the age of 50, it is estimated that about 50% of those strokes can be attributed to APS. Also, when looking at the rate of recurrent miscarriages, about 10 to 25% of the women who have experienced these pregnancy losses also go on to have a diagnosis of APS. Let's dive a little further into the pathophysiology of antiphospholipid syndrome. So contrary to its name, it actually does not involve attacking phospholipid proteins. However, the antibodies associated with APS are directed towards plasma proteins. Plasma proteins are simply put as various floating proteins that are found in the blood. The antibodies that attack these proteins have been identified as a lupus anticoagulant, anticardiolipin antibodies, and anti-beta 2 glycoprotein 1 antibodies. In terms of the pathophysiology of antiphospholipid syndrome, the actual definitive pathophysiology of the disease is still to be determined. However, a great deal of research has been done looking at the beta 2 glycoprotein antibodies and how they react in the blood in order to cause some clotting issues. In a normal, healthy individual, a clotting cascade occurs after an injury or trauma to the endothelial cell. The body then creates a platelet plug, and various clotting factors are released, basically calling in for some support from fibrin to help basically provide some mesh to that platelet plug and create a stronger clot to allow for healing. However, with antiphospholipid syndrome, clotting is a little bit of a more different story. With APS, especially when looking at the anti-beta glycoprotein 1 antibodies, they will attack the beta glycoprotein 1 plasma proteins. And in this, they actually end up adhering to each other and forming a dimer, which is simply two molecules that are linked together. What's special about this dimer is that it is now capable of binding with platelets. Platelet adhesion then causes clot formation that can happen simply in free-flowing blood, and it can also help bind endothelial cells. Both of these can cause the thrombolytic events that occur with APS. This diagram shows the initial pathogenesis that we just discussed with antiphospholipid syndrome. When looking at the pathophysiology, it's also important to note that there is the two-hit hypothesis, which pretty much explains why someone can have these antiphospholipid antibodies in their blood and not have repeated thrombolytic events and constantly have clotting issues. This hypothesis says that the actual clotting mechanism is triggered by an infection or a trauma and sometimes an environmental exposure, which then in turn activates the antibodies and the clotting process that occurs. So we know antiphospholipid syndrome can affect clotting, but it also is a huge cause of miscarriages in women. It's believed that the complement cascade is disorganized with those with antiphospholipid syndrome, and that can attribute to the recurrent miscarriages. Complement cascade in a healthy person is basically an inflammatory response that occurs. Various proteins across this cascade have different functions and signal for the next protein to react. With APS, specifically, the C3 protein is not functioning properly. In a healthy individual, C3 helps to mediate the inflammatory response. However, in APS, with the lower levels, it has a disorganized complement cascade and can be a cause for poor OB outcomes. It's also noted that those in APS may have a higher concentration of complement fragments, which can also be responsible for activating that inflammatory cascade. Signs and symptoms for antiphospholipid syndrome include recurrent miscarriages, stroke, DVT, and previous diagnosis of autoimmune disease. It's important to note that many times people go on with APS not knowing they have it until they have one of these unfortunate events happen, and then they seek treatment. In order to diagnose APS, one must have had either a thrombolytic event or recurrent miscarriages. That is part of the diagnostic criteria, in addition to a series of blood tests. Doctors will draw both a coagulation test and an immunological test. The coagulation test looks at the lupus anticoagulant and basically the body's ability to respond to any phospholipid-dependent clotting issues. The immunological test looks at the anticardiolipin enzyme-linked assay. A lot of times, a patient will have a positive test for one of these and a negative for the other. However, they are still considered to have APS. And it is recommended that the blood tests are repeated in 6 to 8 weeks to confirm diagnosis. Treatment for antiphospholipid syndrome varies patient to patient. The treatment of choice is blood thinners, including subcutaneous heparin, warfarin, aspirin, and Plavix. It's important to note that with these medications, frequent lab draws are needed to confirm therapeutic levels. However, treatment is not always necessary depending on the severity of the patient's disease and the levels of their blood work. Lifestyle modifications, like most diseases, is always important. Things like smoking cessation and exercise should definitely be recommended for this population. It's also important to educate that hormonal birth control should be avoided, as the hormones that are in birth control, as well as the ones that are associated with pregnancy, are believed to have an effect on the development of clots with antiphospholipid syndrome. In conclusion, APS is autoimmune and there are abnormal antibodies present in their blood. These antibodies interact with the blood proteins and will increase the risk for stroke, miscarriage, pulmonary embolism, and unfortunately fetal demise. And while treatment varies by individual, many are placed on anticoagulant therapy and counseled on pregnancy-related complications. Thank you for listening, and I hope you have a great day.